Hello? Can everybody hear us? This is our first time doing this. Can someone say hello?
Say something.
I think it's working.
Oh, look. People said
they're
working.
typing. Working.
Yay.
All right.
Cool.
Awesome. Can you hear us okay? Hopefully you guys can.
Let us know if not.
So introductions.
So I'm Emilie. I think I know most of you, and I'm so glad we can be here virtually with you guys. And it's neat to see all your little things popping up. So, yeah.
I'm Shea Suskin. I'm the newbie over here. I started with the practice in January, so I'm also happy to be here and happy to figure out how we can best support you through this crazy time.
James Gaor. I've met some of you, maybe not others, but welcome. And we wanted to take this time, I think it's an opportunity to really just reach out to you guys in this time of social distancing. One of the terms I heard of recently is the concept of social solidarity. So as a community, we've always felt that everybody in our practice and even beyond our practice, this is something we wanted to foster, and especially during this time, this being a forum for us to add clarity in a time of confusion. And so thank you for all of your responses. We got a ton of questions, so we're gonna kind of jump in because I wanna respect everybody's input. And if we don't answer your questions, and some of them are very detailed, you always know that we're here for you guys. So we can talk to you on the phone, we can message you. We're very happy to answer all of the questions. So we apologize in advance if we don't answer your questions, because we have so much to go through, but we'll jump right in. So we're going to break it down into blocks a little bit. A lot of people have questions about clinical aspects of it, meaning symptoms, when should I get tested, what should I be concerned about? So do you guys want to speak to you in terms of what symptoms to look out for? A lot of you guys have heard about it already, but the main symptoms to be concerned about?
Well, the most common symptom that that's been reported so far is fever. So that's definitely something to call us about. Fever, cough, dry cough usually, but if any kind of cough, that's up there in that triad. Those are the main ones.
Yeah, and if people are short of breath, that's another reason for sure that we want to hear from you. So those two big things, if you're having a fever, and a fever is over 100.4, not 104, but 100.4. So if you are at that level, or you're having any trouble breathing or tightness in your chest, please give us a call. And then, there are all these questions about the milder versions of this, and that's where things get complex, because this can look like the common cold to some people. Some people don't have fever. Some people just have a mild sore throat or runny nose. Some people have diarrhea. So we are here to answer your questions. We do have access to test kits, and we're using them here so that we can help you guys feel safe, and also making sure that we're being practical and thoughtful about how we use them. So because there is so much complexity to how this presents, if you have questions, you reach out to us. We're here to comfort you guys and talk about if you need a test. As some more information, we've had a number of people that we've tested already who have actually shown that they have the common cold. So that is going around right now. So some of you, if you're snuffly and having some of those symptoms, it's not a guarantee that you have COVID. So still you want to isolate yourself, but just that's been reassuring to me the last few days.
There's just so many individual considerations in all of this. So we really would just rather hear from you if you have any question or concern, and we want to talk to you about, what your life looks like and how much you're able to limit contact with others and who you're in contact with, and what your daily routine has been in the days before you started having symptoms. All of those are really important to hear and to parse out. And so just, let us know, let us talk you through it.
And I think that the message there in summary is there's a lot of blunt instruments being used right now in terms of trying to control the unknown. And so part of what we can be able to provide is a little more precision for everybody on an individual basis. And so we really appreciate the fact we can communicate with you and provide that type of, once again, a little more personalized consultation where are you really at risk? And if so, is testing really worthwhile? And we'll go into this a little bit later in terms of what that means. Just to step back a little bit, they've already mentioned it briefly, but really this is, at the end of the day, for the vast majority of people, really going to end up being a cough and cold type of scenario in terms of what you're going to experience if you have coronavirus or COVID. And so just to reassure people, as we go through this, that the recommendations for treatment, and we'll also talk about that later, really comes down to the same type of recommendations we've made in the past for just treating the common cold. So in terms of symptoms, going back to that, yeah, it's essentially the common cold, which is very frustrating because the cold is going around. Fever, body aches, also flu-like symptoms. And so once again, we're talking to people individually to risk stratify and make sure if testing is appropriate, we're all on the same page of what that means.
Mm-hmm. So maybe we could piggyback off that to further talk about appropriateness of testing. One thing that's come up, and I think there's a question somewhere in here about it, is if I don't have any symptoms yet, what are the chances of asymptomatic spread and all of that? That is something that we are going to consider when talking about what exposures you've had and whether it's appropriate to be tested or not. If you're not actively coughing or don't have active symptoms, we want to just keep a really close eye on things because it's possible to get a false negative on the test if we test too early, if we test before you've really developed symptoms, even if there's some chance of exposure or something like that you're concerned about. So that's another one of those kind of individual considerations. We just need to hear from you and hear what your concerns are, and then thankfully we have the capacity to be able to check in with you closely and see how things are developing. But that might be a consideration why we might choose not to test, at a point where you're concerned.
And to talk to you guys about the tests that we have have some test kits from LabCorp and Quest, and what they've told us is that they will replenish them as we use them. And so we are kind of uncertain as to what that would mean as far as timing goes. And then we also have some test kits from a private lab in Texas that we've been in contact with. They are a certified lab, and they have told us they have an ample supply of tests. With all the news that you guys are hearing and we're hearing too, we're a tiny bit anxious about, is that really true and how long will that go on? So we're trying to be really thoughtful about how we use what we have, but at this point we do have plenty of test kits for the moment. So just wanted to put that out there to comfort you guys a bit.
Some of the specific questions someone asked, don't want to burden us unless it gets serious. When should we be concerned in terms of contacting you, or us, I should say? So one of the things to definitely to contact us if you have significant symptoms that you feel like I might need to go to the hospital for, we definitely want to hear from you and advise you appropriately. It's something where we're always going to be in contact with you, so you shouldn't feel like you're burdening us, and we want to be able to answer your questions. So I don't want people to feel like it's a burden. Temperature spike is a common one. Is there a particular temperature to be concerned about? My general consensus that many of my patients know is I don't think a number or temperature is something to hang your hat on. It's more about your symptoms. And so subjective fever without documented temperature is still actually just as legitimate of a symptom. And you don't need to go out and buy a thermometer in order to diagnose a viral flu or coronavirus illness. So
by subjective fever, James means that if you feel like you have a fever.
Correct. So sorry for the jargon.
Yeah, but you kind of know what that feels like. If you've got the shaking chills or your body just feels warm all over, that could
be a fever,
and you don't feel good.
I've had people tell me, "Oh my gosh, there's no more thermometers. I got to go buy one." And so we can just talk you down off that ledge. Just if you don't feel good, you call us. And you're not a burden. Everybody who's called has been apologizing. That's why you guys have us. So you're not a burden.
And if our symptoms are mild, do we really need to bother getting tested? Great question. You don't need to, because this goes into the management of it that I pointed out earlier. The treatment, whether or not it's positive or negative, is pretty much the same. There's no medicines to treat it. There's no vaccines to prevent it. Getting good rest, eating well, and staying, minimizing contact with others, regardless of if it's coronavirus or not, is still the recommendation. So If you're feeling concerned about it, really, if you're at high risk for exposing a lot of other people due to work or whatever situation, it might be more reasonable to know, because that clearly may impact how you make those decisions. But I still think, once again, it's not a definite necessary if you're having mild symptoms. I left that there.
How does COVID-19 spread?
So how does it spread?
That's a good question. So the thought now is that this spreads through droplets, and what that means is that it's like a cold, where if you cough on your hand and the droplets that come out of your mouth, or the mucus that you have on your eyes or in your nose, if it gets on your hand and then it gets on a table, and then somebody else touches the table and then they touch their face, then they can get the virus. And so the reason for social distancing is, like, if you're talking to someone and there's a bit of, I don't know, spray that might come out as you talk. Not all of us are that way, but we live together. So, right. So that's kind of the idea, is that, and that's why we're wearing masks, is that just to minimize that if somebody coughs in your face or someone's close to you, it can spread that way.
And so there's been some confusion about that, because at first we were thinking this might be airborne, versus it just got downgraded this week to now the science is pretty consistent. It's looking like it's definitely droplet in the way that it spread. And so you might be seeing on the news, there's some strikes in some hospitals. Some nurses are very upset about this being downgraded from airborne to droplet. That changes the recommendations that are being made in hospitals and how to protect ourselves. But it's actually a good thing. The virus is not seeming like it's, an airborne virus. James gave the example when we were talking about this morning of, if two, asymptomatic people are walking down the street, can I catch it just from breathing the air that person is breathing? Is it just floating around in the air? And it doesn't appear to be airborne. Someone needs to actually cough. There needs to be respiratory secretions, and it lands on a surface, and then you touch that surface. So,
if
so
you're
hopefully
walking,
that makes more sense.
If you're walking at
Feel
the
free
park,
to take questions if it's not.
Yeah, if you're walking at the park, you don't need to put a mask on if you're far away from the other people at the park. If someone comes up to you and starts talking in your face, just back off. So masks are not essential if you're doing social distancing.
And I think that then spills over. There are some kind of, again, James and I were talking about this, there are some kind of more specific questions about, how do I handle packages that are coming in the mail if I'm getting grocery delivered? We could kind of, continue spiraling and ask a million questions like that. The best bottom line recommendation, now that we know it's droplet, is the way that it spread is really aggressive and frequent hand washing. Do the best you can. If there's something you have to touch, you can consider wiping it down. But as long as you're washing your hands, every time you do, need to touch a surface like that, try to wash your hands, especially every time before you're going to touch your face or sit down to eat, or something like that. So that's kind of the bottom line for
what I've heard said, and
transmission.
maybe James can pipe in on this, but if you order takeout, they say take it out of the package, throw away the package, and wash your hands and eat. That the food itself, you were telling me this. You said.
Yeah, so it's not from cooked food. As far as we know currently, there's no evidence to suggest that it can be transmitted through cooked food. And so getting takeout, at this point in time is not something I would be concerned about. As Emilie alluded to, just making the habit of, once again, it seems really annoying to repeat this over and over again, like we're kindergartners, but just wash your hands every time you eat. You want to avoid touching your face. That really mitigates or just reduces all the anxiety of the what ifs if you're just really being diligent and mindful about washing your hands and keeping good hygiene. Then really, no matter how long it could potentially last on a surface, it doesn't matter because I'm washing my hands. So that's one way to encourage people to develop good habits.
And there was one question later here about hand washing specifically. Do we need to worry about antibacterial soap, or is that going to create resistance for the virus, that kind of thing? You don't necessarily need to use antibacterial soap. Any soap disrupts the structure of the virus. The lipid bilayer of the virus is what it's called. So any soap, it's more about how long you're leaving it on your hands, making sure you're covering all surfaces. There's lots of graphics that have been being sent around about the correct way to wash your hands. I'm trying to get creative with my kids and pick the songs we want to sing while they're washing their hands. Make sure you're doing higher up on your wrist and, getting your fingernails, getting all the surfaces that you wouldn't normally get, just, quick hand washing review. But yeah, the type of soap, it doesn't necessarily need to be antibacterial.
And does it need to be 20 seconds every time?
That's a good question. Right now, the recommendation is 20 seconds. Somebody just chimed in asking
Yeah,
about 20 seconds. So yes, I would say yes. The more, the better. So to get a little sciencey on you. So if you remember science, like dissolves like. And so things that are water soluble, they dissolve in water. So to think about the coronavirus, it has little fat coating on top. And so what soap, just plain old soap does, soap is fat. And so it dissolves each other. So you actually disrupt the little outer coating of the virus and kill it. So that's what just plain old soap can do. You don't need anything fancy. Clearly, we don't have a tub of water and soap wherever we go. So that's why hand sanitizers can be an alternative and can be more convenient. And those are effective as well. But when you're at home, if you're out and you happen to have soap and water, it's more than adequate to be something to use. And somebody chimed in real quick about cold food.
Yeah.
I don't have a great answer to that. There's a lot of unknowns right now. I personally wouldn't be concerned about that. There hasn't been a lot of evidence to support the food chain as being something that is causing the high transmissibility of this at this time.
Like any time, if you get veggies and fruits from the store, you wash them. It's the same thing, right? I mean, you're going to take things off the surface of that fruit just with the rushing of the water over the fruit and veggies. So,
but prepared cold food, I guess, is one of the concerns.
So you hope the people you're ordering it from are adhering to standards. And our restaurants are pretty well monitored, and I have a degree of trust in our community and the restaurants that we have. So
example of social solidarity of hand washing in sushi restaurants. So please, if you're a sushi restaurant chef,
someone also typed on here, how long does it stay on surfaces?
We were just talking about this.
What I had been seeing initially, this might have been changed, but I had been seeing 9 days on hard surfaces, on metal or plastic. So I think up to 9 days. We've seen other estimates that it's lower, like 3.
Yeah,
and it depends on the surface. So I was reading this as well. So depending on the surface, cardboard, copper, stainless steel, it ranges from a few hours to a couple days. And once again, going back, you can spin wheels in your head, thinking or being worried about the timing of everything. When really at the end of the day, if you really need to disinfect it. Otherwise, just please wash your hands. Then you just will eliminate that anxiety if possible by just keeping that in mind.
Yeah, and if you wipe the surface down, then it's not there anymore. Right. So there's that too.
I don't want to lose higher up. Michelle, I saw your question about my partner is in healthcare. He's still seeing patients. What are precautions we should take, or what can I do to stay well? I know a few of my patients have family members in healthcare as well that are still out there seeing patients. So maybe we could talk about some of the minor things we're doing after we see patients. We are, Emily and I have just been talking about this morning. We're feeling safest changing our clothes as soon as we get home. Just simple things like that. Obviously, lots of hand washing. Any other specific things you're doing on that?
At our office, we're seeing anybody who's sick in the car to protect ourselves. But I don't know what your partner's doing, so it's a tough one to say.
Yeah.
Maybe that's something you can call us on individually, and we can talk about what's going on.
Yeah, that could be an individualized one. That's a great question. There's ER doctors working out there, and they're living in garages for a month. So it's just really hard to say based on.
Right. There's a spectrum of what kind of contact we're getting in different areas of healthcare. So let us know.
Let's see. There was a question about walking a dog that kind of popped up.
Yeah.
I think.
And I know who asked it, but I would say to the person who asked it, if I know you're in an elevator building, and I know who you are. So if you can figure out a way to get out of your building without being in contact with people, and you bring a wipe when you touch those buttons, I just want you to be extra careful because you are someone who's more vulnerable. So if you're in a situation and you're over 65 or you have underlying medical illness and you're in a building with an elevator and you want to walk your dog, I mean, you got to take your dog out. You can't be trapped in your apartment. And so you just take the precautions. If you see people in the hall, you stay away from them. You bring a wipe with you or something, a tissue even to touch the buttons with, and you throw that away on your way out and your way in, and you wash your hands.
Sounds good. Just to get back to these questions, and we'll try to get back to the chat as well. Some people submitted questions from our practice. So great one, seniors with no underlying health issues. Just asking about daily activities of living, right? So can I go get a haircut? Can I go to the dentist? Which unfortunately, I think a lot of them shut down. So that's the answer to that one. People with asthma who's controlled and other underlying conditions, how do we address our seniors in our population, and what is the current recommendations?
I would say even if the hairdresser opens, I still wouldn't go right now. I think we need you guys, vulnerable people, and I've tried to call a lot of you. You guys have to stay home and do everything you can not to go out. And we'll reevaluate in 2 weeks and see where things are. And we're taking this a bit at a time. It could be a long haul, but we just have to take it little bits at a time.
Yeah, no, I agree. Definitely.
And talking about blunt instruments in terms of public policy.
He keeps saying blunt instruments. He's
I'm
not
sorry.
coming after anybody with a club. Don't worry.
Well, I might, but
No,
I think,
he's not. He's not.
So just
nice.
broad measures, dramatic things we're doing as a society, which is not only inconvenient, but really just upending everything. The reason we're doing that is because there's just a lot of unknown, but we're trying to extrapolate from what's happened elsewhere in the world. And if you look at the data, this is, for the most part, been a very age-associated condition in terms of bad complications. So that's why we're being more aggressive about people in older age groups, because that's what the data shows. As far as we have right now, we could use more data to make it a little more precise for us, but currently that's the best data we have, and we're rolling with it. And that's why hopefully we can have more of these. So if things change next week, we can update you. But that's why we're recommending that. And it seems pretty harsh, and it's meant because that's all the information we can gather right now, unfortunately. So.
And I would say if you're a vulnerable person and you have the chance now to start researching online groceries, because there might be a delay in your order. So if you have enough milk now, but you think you're going to run out in a week, maybe today's the day to go online and see how you can get that going so that you can get it delivered, or if you have kids that can deliver it. Just being a little proactive if you can.
And there's some questions about the period of what to be concerned about, the incubation period. So we just asked here as well. So this is what's tricky about this. We're seeing incubation periods of 14 days. And that term means you have the virus and you have no symptoms. And so that's really tricky. It could be a few days, it could be up to 14 days. And so that's why at this point in time, such drastic measures have been taken to minimize how quickly this can clearly spread if, once again, the incubation period is so long. And so that's just the current state where we're at.
And Julia just asked if you guys could go visit your parents. If you're young and you have kids and you're quarantining, no, you can't go visit your parents. I don't recommend it. It is not worth it right now. Call them, FaceTime them, but don't bring your kids over there. It's heartbreaking because we don't want to isolate our parents, but it's worth it. Just for now, we're taking, like I said, a little bit at a time, but stay away.
Yeah, and going to that, there's a question, just piggybacking on that, because that's an important point, is, a lot of people, we have parents, grandparents who need assistance, right? So how can we help support them best in terms of their activities of daily living? Do the best we can. It's still the same guidelines as what we recommend before. So in terms of grocery shopping, there's delivery services that are, I'm sure getting inundated with business right now. We can do our own personal part of helping deliver for people that whether it's our neighbors or our family. Once again, of building social solidarity, that would be a great opportunity for us. Once again, just being very mindful of good hygiene while we're doing that, and helping maybe educate them about good hygiene. That's the best we can do. And also just being able to keep in touch, whether it's a phone call, text message, video chats like this, I think is going to be a very big cultural shift for us in terms of how we define relationships and community. So for the time being, that's that's what we recommend unless there's something else you guys want to.
I would just piggyback on that a little bit, and you guys feel free to disagree with me, but within that, also do the best you can. I know there's some of our families right now that are really struggling with figuring out how to care for their children who are at home and trying to work from home, and grandparents possibly are their only resource for being able to do very important work that you're all still needing to do somehow with your kids at home. And we can kind of do the best you can, take things on a case-by-case basis. If you have parents that are in their 60s, but that are really healthy and don't have a lot of medical conditions, don't have high-risk medical conditions. If your kids aren't toddlers and they're old enough to be able to wash their hands frequently and they haven't been sick at all and you've been quarantining at home, I just want to soften that a little bit, because I know all of us are trying to figure out.
She's nicer than me.
Routines and how to make our lives work right now, and it's tough. So
yeah, and onto that note, if somebody tested positive, let's see, still working. Some of my dads were tested positive. So quarantining, so staying and minimizing contact with others, 14 days because of the incubation period. While we're on that topic, that's the time frame currently that we're recommending, because that's when you could potentially develop symptoms and be contagious. So we just want to limit that time. Let's see. A lot of these questions we kind of answered. So
What about the ibuprofen one?
Oh,
Everybody's asking that. Yeah.
Ibuprofen, yeah. So I'm going to start, and you guys can correct me.
Go ahead,
Yeah, please.
So there were some small studies. So the question is, there was a statement from France discouraging people from using ibuprofen because it is an anti-inflammatory, and so the thought was that it could potentially cause significant downside for people who develop COVID in the future, in terms of the inflammatory process. There has been no substantiated evidence to support that at this time. So we are not, it's theoretical and not something we've recommended to people to avoid ibuprofen, Motrin, Advil. So there's just no evidence. There's been a small kind of theoretical association made with that, but at this point in time has not been definitively or even has a lot of evidence behind it.
On that to piggyback on that, there's also this question of ibuprofen is not going to save you from anything as far as your overall health for this. So I was on a podcast this morning with an ID expert who was saying, for now, if you can just use Tylenol, then why not just use Tylenol? If you're feeling really bad and you need something to feel better, then Tylenol is a good place to start. What James and I were talking about earlier is neither of those things are necessarily an absolute. So if you feel bad and you feel like you can rest and eat healthy, I've told a lot of you this, sort of fever is a natural antiviral or an antibiotic. And so we know that these viruses may not survive as well when you have a fever. It's your body trying to fight it back. So you clamping down on the fever isn't really something that's needed for you to get better. But there's no reason for you to be in complete misery. So if you're really uncomfortable, then you can take it. And we have some Tylenol here. If you guys are having a hard time accessing it, we can give you guys a little bottle of it. You can drive up and you can toss it at your car. And then someone asked about ACE inhibitors. I also heard from the ID expert this morning, basically saying same kind of thing that James is saying. It's theoretical. We don't really know. And for that reason, if you're on an ACE inhibitor, don't stop it. You stay on it. It clearly, given now, maybe you won't start on an ACE inhibitor. If there's another option for blood pressure management, we'll think about something else. But it's just not something that's proven enough for you to upend your appropriate medication, treatment, and management of your blood pressure, which is important for you to have control right now too.
Last point on that, there's similar considerations for elderberry. There's some talk about that. Again, it's all theoretical. I don't think it's substantiated yet, but that it could affect these same inflammatory pathways that could potentially make your response to COVID worse if you are infected with COVID. So again, similarly, if you're one of my patients, you've probably heard me recommend elderberry. We love elderberry in my house, but we're just again, based on the very theoretical risk that it could affect these inflammatory cascades, we're laying low on that and looking at other ways to just boost our immune systems and keep us healthy right now. Primarily just the building blocks that we've all talked about with all of you. Make sure you're getting enough sleep. Try to get a little fresh air in ways that you can every day. Try to manage stress as best you can. Let us be here for you in that. Try to eat fresh, healthy food as best you can and avoid, too much processed food and sugar and things like that right now. So try to get a little physical activity, a little movement, home exercise videos or whatever you can do. Those basic building blocks are going to be better than any supplement or anything else right now. So the best ways you can optimize those things.
I had a conversation with somebody the other day, and I liken this to just really a big unwanted reset button, if you will, in terms of the way we conduct our daily lives. So this, when seen through a different lens, this is a great opportunity to just reassess where you're at. And like Shea's point, I think we've all lived very fast-paced lives for a while. So now we're forced to slow down and really just examine what, unfortunately a lot of times out of fear, which is not the best place, but regardless, just re-examining what are the important things to stay healthy and eating good food, getting good movement. And all my patients know this as well, the 4 building blocks of what we talk about every year: food, movement, sleep, and mindfulness. How do we, can we reassess that, and what ways can we optimize that? And so that's what we're all here for you in terms of answering your individual questions about that. But that, the big reset button has been hit. And so now we have the opportunity to re-examine everything. So take that as you may.
When people are asking, some people are having a lot of anxiety and asking for resources, how, if I'm really kind of losing it here, where can I start? And so we are here to talk to you guys. We are happy to reach out. There are plenty of therapists who have reached out to us and said, we're still doing telemedicine support. We're still here if people need counseling. So if you guys want to reach out to us, we can put you in touch with those resources too. And if you're not sleeping and you've tried Headspace and you've tried the Calm app and you want to talk about safe options for medications, we can talk about that too. As far as supplements go, sometimes melatonin can help people calm down a little bit. It's safe to use short term. You can look at teas like valerian root or lemon balm teas can kind of help you a little bit. Chamomile.
Even just chamomile, yeah.
Yeah. So someone actually just wrote, so my wife verified, I know who it is. His wife is a nutritionist, that elderberry is really bad. And so I just want to make sure you guys heard Shea appropriately. What she was saying was, although it's been something she's recommended in the past, for now we're saying hold off on it because we don't know. It's just like what we're saying about a lot of things.
Yeah, thank you for clarifying.
Yeah, just to make sure you guys heard that right.
And a lot of, I think, what's going on now is the root of it is really just the fear of the unknown. So all of this is just stems from that. So if there's any way to focus on the things you can control and being able to feel empowered in that, and once again finding support with community, friends, family, clearly us, those are the resources that I think will help best support you. And clearly there's ways that Emilie mentioned: therapist, meditation, all of these things. So yeah. Okay.
I see Max's question, and I think someone had typed in this question as well about the meme that's been going around. I've seen that meme too, about if you gurgle with salt water, like it lodges in the throat. If you gurgle with salt water, you can maybe decrease transmission, or if you take many sips of water throughout the day, you can decrease transmission. I don't think we have any evidence of that. I don't think that's evidence-based at all.
No.
It's good to stay hydrated. Drink your water as a
water's
baseline
good.
anyway. But gurgling with salt water, we have no evidence that indicates that's going to kill the virus or decrease transmission.
Same with drinking lots of water. That's another statement that's been circulating out there. If you drink water more frequently, warm water, heat is another one. So another misperception is, heat will destroy the virus. So people are being in warmer temperatures more, or artificially increasing the temperature. It could most likely cause more harm than good. So we wouldn't routinely recommend that. So that's another one that we've heard a little bit out there.
Yeah, don't put your body under stress by drinking too much water or heating yourself out. Like, just put yourself in a place where your body feels good. Someone asked if they go to the grocery store, do they have to come home and wash their clothes? You know, Shea and I were talking about healthcare workers. We have people who are sick coming to us and in our space. So, well, they're out in the car in our parking lot. But so
we're getting in there and getting
in
in
when I when I go to the grocery store, I don't come home and change my clothes. I'm making sure that I shower more, and I am washing my clothes more. Sometimes I used to just like if I didn't. But
I'm in every other day shower. Now I'm showering every day. That's my big routine change.
I mean, sometimes you just can rewear the sweater, but now I'm washing them
clothes every
time.
Yeah, that's a change for me too.
I just wipe myself with hand sanitizer.
Just take some
I'm
bath
going to
in
make
it.
you take a shower.
I do take a shower. I know this is probably going to be recorded. It's unfortunate.
TMI, sorry guys.
Yeah. So yeah, along that note, let's see. There was another question. So just to clarify the testing for patients in our practice, we do have drive-up testing here. So once again, if we decide that would be the next step, we also just want to remind people just to stay in your cars. We will be appropriately gowned and masked, and we can perform a quick drive-up testing here, and we'll swab your boogers and see if you have coronavirus. There's that.
Somebody asked, have any young and otherwise healthy people with no medical concerns been treated in the ICU and died? And the answer is yes. We have seen people in their 30s and 40s die from this. So it's clearly not the most common. And so when we talk about this, and we just want to make sure that people are being cautious. It's statistically speaking, if you're in your 30s and 40s and get this, you're more likely going to be fine. But it's not just like a no big deal. Let's all go out and have a coronavirus party and all get it so we can get this over with. I wouldn't look at it that way. If you're young and healthy, I would look at it with caution and care.
Right. And so just not to cost too much here, that's a small percentage, once again. And the reason, just statistically speaking, from what we've seen elsewhere, it's still dramatically the older patients, 80 and above for sure. And then as we get younger, it's less of a concern, but still a concern. And not only on a personal individual level, but once again, on a public health perspective, when we talk statistically what the possibilities are with this, that's why we're being so aggressive about our policies. Let's see.
And I was going to answer the question about drinking bleach, but it looks like one of the patients already cut in and answered the question. So as long as you wash it down with Tide Pods, I'm just going to leave that there.
Oh my God, no, don't do those things. Please don't drink bleach.
Find bleach at the grocery store right now anyway, so just steer clear.
Let's see, other questions.
Oh, how long to get the test results back? Did we talk about that?
No.
So with the initial commercial labs that we were doing testing through, it was 3 to 5 days. So that was a bit longer. This new lab that we just started using that's in Texas is 24-hour turnaround time. But we usually are submitting all of our tests that we've done for the day at the end of the day in a batch. So they arrive at that Texas lab in the evening. So it usually ends up being like Monday's tests went out at the end of the day. We got the results back, or the results came through like around midnight last night. So those patients who were tested Monday got their results this morning. So we're telling, it's
like 48 hours.
Yeah.
Yeah. So you'll have your test back in 48 hours.
But trust us, we're checking regularly. We know those of you that have been tested and will be tested, we know it's a high anxiety place to be in. So we will let you know as soon as we know.
There's one question, I think, going to a public health theme now, just hearing conflicting information regarding the seriousness of contracting the virus, saying that they'll see unprecedented number of deaths. At the end of the article, they say for most people, especially young people who are healthy, the symptoms will be minor, and they're confused about that messaging, meaning most of us, like I alluded to before, will be fine and we'll just have a cold, but yet we're talking about the fear of so many deaths. And that can understandably be very confusing, because if most people are fine, then why are you talking about so many deaths? And we just want to put it on a numbers game. So, in the country, we'll talk about the US, there's 370 million people. The flu season so far has the deaths associated with flu range from 20,000 to 55,000 based on how you report it, which leaves it at about roughly, we'll call it 0.1%. Now, when we look at other countries, it ranges from 2 to 3% mortality rates. Let's hope that we can, by doing this, and because of maybe our different population, even if it's 1%, we're still looking at a tenfold increase of potential harm and deaths to people. That's on top of the flu season already. So even though the vast majority of people, the 99% of people, will not suffer those consequences, that's still a lot of people that, when we think about, can be prevented. It's something that we don't take that lightly for obvious reasons. So that's once again the public health lens of social solidarity. That's why we're doing this. That's why we're tanking the economy right now, intentionally, because of that. Because either way, the economy is going to tank. At least we can save some lives doing it, I guess, is kind of a gross statement to make.
It's because we still love our parents.
Yeah, that's true. So, so yes, that's the answer.
And in some ways, if you think about this, if this were, you think about the potential loss of life, this is a really big deal, and it's a crisis, and we're all first responders here. Like, we all have it in our hands to save lives. So even though maybe in your self-interest, you're young and healthy, it's not something that you're concerned about, it's still, you could still be altruistic, and you could still see this as, like, if we were to go and fight this enemy, it means you're going to be a participant too, and you might save someone's parents. So,
and the challenge in that, I think, is that we're not going to see any of the results of any of these actions for about another month or two. So that's a really challenging message to give to people, where you say, hey, you got to stay home from work, close all these businesses, so that we can potentially, alter the course of the future for so many people, and yet we won't know for another month or two. That's really challenging, and I understand that challenge, but it is something. Once again, this is a statistics game that we're playing, and that's the hope. So we hope that what we're all trying to do is going to be very helpful. Yeah.
Well said. There's a couple questions in here about wearing masks. Why are we being
Please.
told not to wear masks? And you guys can chime in. My understanding is it's so much more likely that the virus is going to get on your hands. Your hands are really the air, especially now that we know it's not something you breathe in. It's much more likely that you're going to touch a surface with your hands. So the masks can provide false reassurance. It's also very tricky to make sure you're taking the mask off in the correct way. It can kind of be higher risk to, again, the concern is just that you can get false reassurance that if you wear this mask, then you might not need to take the other precautions, again, namely washing your hands. And it just hasn't been shown on a large scale to decrease transmission that much.
Right. And there's no physical harm to people for using the mask, outside of potentially false reassurance, like Shea had mentioned, where you become overly confident about your protection from it. There is a slight downstream negative, which is really just focusing on giving that resource to somebody who does need it, like a healthcare worker. And so I won't go too much into this, but we really want to make sure everybody who needs a mask in healthcare settings, dealing with high-risk populations, has the materials they need. And right now that is actually an issue. And also on that point, another point that we're doing all of this is this term called flattening the curve that I think has been out there for a while now. And once again, going back to the public health lens, there's only so many resources. And so we want to make sure when people get sick, they have the appropriate resources. If we flood the system with too many people needing to be admitted to the hospital, needing a ventilator, that is really why we're doing this. And we're seeing places like Italy really suffer from not having the resources and having a really sharp peak too quickly. So that's why we're taking such drastic measures.
And I've heard people kind of say, well, there's only, how many cases are in Orange County? We just
29,
29.
Yesterday.
Yeah.
29 cases
29
in Orange
cases in Orange
County,
County.
and nobody's died?
Yeah, no, there's no deaths.
No.
Correct.
And so people are saying, what is going on? Why are you guys all freaking out? Like 29 people have this and nobody's died. And so the point is, we're freaking out because if we don't, that 29 cases can turn into a vast amount, and the number of deaths could exceed our ability, or the number of need for the hospital could exceed our ability to manage. And that's a local concern. And that's based on what we've seen going on in the rest of the world. This is not like some conspiracy theory. This is not politics. This is looking at the data and seeing how this virus has behaved in these communities that we have the world as a study. We've seen Italy, we've seen now Spain, and we've seen what's happened in China. So we have some really smart people looking at that and saying, look, if you guys get ahead of this, this is what the numbers are going to look like. And we have some clarity on that. So if any of you guys want more detail on that, we can provide that. There's a study put out of the UK that really has sort of pushed some of this public policy forward. And if you look at what a difference what we're doing now could make, it's pretty amazing, and just makes it worth every minute of Netflix binging that you're doing. So.
Perfect. Foods, supplements, we kind of touched on this a little bit in terms of boosting immune system. They have training in integrative health. And
someone asked about vitamin D. I think vitamin D is not a bad idea. That can help boost the immune system if you have some at home, if you're taking that already anyway. Usually I like to check levels and base my recommendations on that. But in general, right now, vitamin D is not a bad idea. Again, I would reiterate the basic building blocks. It's most important than any supplement to make sure you're getting enough sleep, make sure you're getting healthy food, make sure you're getting a little movement every day, and some fresh air and stress management as best you can.
Too,
but
like with the, go ahead.
But yeah, foods that are high in vitamin C. We do probiotics in my house. That's not something that's going to acutely shorten your symptoms if you get sick, but in general, taking a probiotic every day, there's been some studies that can support your immune system. I can give you specific recommendations about that, about types of probiotics. If anyone's interested, let me know.
It's so tricky too, because there's all this new information and misinformation and confusion about, we talked about elderberry, and I think we just confused everybody. Right? So I think, and not you, but just because it's so confusing. And I think the same thing, I don't know what's going to happen when we find out more about this virus. What are we going to find out about other supplements and how they affect the virus? And so we're kind of coming at you with our general sense of how we manage typical kind of cough cold season, and vitamin D and vitamin C and probiotics and all these things don't seem like they would do any harm. And I still don't feel like they would do major harm in this case, but we don't really know, right? I mean, we just don't totally know.
Right.
So I don't know what to say about that. We have vitamin D at home, and we've been taking it a little bit, but then I'm like, well, maybe we should just go outside for a walk.
But they taste good though.
They're gummies.
They're gummies.
The kids want them. But there's so much uncertainty. And so if you can't, if you don't have vitamin D in your house, do not go to the store and get it, because that is very clear that you exposing yourself to try to fight for a vitamin C or a vitamin D, it's not worth it. Yep. And maybe we'll find out in 2 months that one of these things made it worse and we didn't know. So please don't push on that. And if you feel like you want to take something and you have questions for us, we can answer them. But we're kind of all in this together on that. And I think I totally echo what Shea's saying. You just take care of yourself and breathe and move your body and sleep and all that.
Great question I have here is what's your guidance on somebody needs an MRI or there's some procedures, right? So health doesn't stop. So what do we recommend to our patients in terms of seeking out diagnostic and routine kind of care? Yeah,
I think we're taking that on a case-by-case basis, and let us know and let us figure that out with you how urgent it is. If it is something that can wait, it's best to wait. And so for most patients, we're going to say, if this is elective, if this is something that we can hold off for a month or so, let's do that. But there are some cases where we can't do that. So.
I had someone today that I was talking to who's been having abdominal pain for a month, and it's not urgent because it's been there for a month. At the same time, we don't really know what's going on, and we wanted to do a CAT scan. And so she's asking me, should I do it now? And part of me said yes, because this is a little bit of the calm before the storm. And if you've been having pain for a month, then we should do it now before, if hopefully things don't get too crazy, but before things possibly get more crazy. So there's that to think of too. If you're having pain, if you're having something going on and you want to talk to us about it, then talk to us. Don't feel like you can't reach out if you're uncomfortable. But like if you need a physical or a skin tag frozen off, or something that you've been meaning to do for years but isn't that important, please, wait. It's not essential. We're really trying to put off routine physicals. So that kind of thing. Elective surgeries, elective procedures. I just would recommend you don't do it.
There's a question about dogs and petting dogs and
yeah.
transmit it that way. We have a dog. So once again, it goes back to hand washing, right? So there isn't I wouldn't be worried about the dog giving or transmitting the virus directly to you. Once again, I believe the question is referring if somebody has active virus, they're sick, and they pet the dog, and then the virus is on the dog. I'm assuming that's what the question is asking. And then maybe you pet the dog. And once again, it just goes back to good hygiene. It's just if you stick to that, and that's why everybody's talking about it over and over again. If you really just stick to making sure you wash your hands, if you're sick, stay home. Really, you're just going to answer the question, answer all of your questions about transmission really by just following those best practices. But I don't know exactly scientifically how much transmittance there would be. But once again, if you just wash your hands, it should be good. Or wash the dog.
Yeah, someone just mentioned that. Yeah.
Wash the dog.
We do wash our dog.
Yeah.
She still stinks.
There's a question. David had a question on here about antibacterial products. Antibacterial products aren't known to have any. It is a virus. So like we were talking about earlier, just regular soap. It doesn't need to be antibacterial soap. And it's how long you're washing your hands for, and that kind of thing. That's more important in terms of other, like the antiseptic gels and things like that. It's more the alcohol in them. They're alcohol based. And so the alcohol is what we expect to kill the virus. I would agree with what you mentioned here, this UCLA doctor that says antibacterial products are not necessary against this virus. And that is correct.
Go bland soap and water, really, at the end of the day, if you have that, is just as good as hand sanitizers.
Someone asked about the designated hours for seniors. What I would say to that is if you absolutely need to go, fine, but seniors can carry the disease too to other people. So if you can order delivery groceries, get groceries delivered and stay in your home at this point, I would do that. I just, again, over these next 10 to 14 days, we just need to see what's going on. And then I think you can make a more informed decision about your risk of going out in the community. At this point, I just would advise you guys, if you are over 65 or sometimes over 60 and or if you have diabetes or lung disease or anything vulnerable, please see if you can get your groceries delivered and reach out to your network to help you.
There's a question about somebody's parents who's older in terms of testing, if they've been told they have the flu, to stay home. If it's documented influenza flu, if somebody tested positive for influenza, the likelihood of you having coronavirus/COVID on top of that is extremely rare, not impossible, but most likely they don't have COVID. I know. I still think you should still take good precautions in terms of staying home until the symptoms have resolved. That would be the advice that I would give.
And I know the person that sent that message, and let's talk, because I hear you saying now that she didn't get tested. So let's talk. We can offer a testing to patients who are part of our practice in the sense of like they're family members of our practice and they need help. So we're offering that. So why don't you reach out to us? I know who you are.
Yeah.
And we'll talk about that. If she's local, we can help you with that.
And in the meantime, once again, going back to the initial statement, I think it's in certain high-risk populations, it would be nice to know. But the treatment and management really is still the same of definitely quarantining, making sure you stay home, not expose ourselves to others if we're not feeling well. And once again, good food, sleep, hydration, and definitely reach out to us for sure.
Yeah, the only reason we're mentioning the testing is because we can do it as a drive-through. If it means that someone else has to get in the car with you, though, or that you have to take public transportation to get here for a test, I don't recommend you do that. So that's when we kind of tip the scale towards maybe you do stay at home, and if there's any sort of distress or anything, that's when we consider you going out. But right?
Yeah, I think that's good.
Yeah.
I saw someone ask a question earlier if we're going to continue doing these. I think that is our plan, at least weekly, to have little. This is so rapidly changing, and I think we're planning to do at least weekly a check-in with all of you. You know, you all are our community, and we're thinking about all of you and concerned about you, and we want to be there for you and support you.
Yeah. And so, the operations, otherwise, another question somebody asked in terms of like medications, can we still, are we operating and distributing medications? The answer is yes. So we're still open. We're still seeing patients here. Clearly, somebody at low risk or no risk and have an urgent issue that needs to be addressed, then yes, our doors are open. We're still seeing patients. Just bear with the different triaging process where we will clearly ask, the reason for visit and making sure you don't have any concerning symptoms that would, increase your risk or anybody else's risk of getting sick. So, yeah.
And, when you guys think about coming to see us, or if you need to pick up a medication, we're going to be doing as much as we can in the parking lot for your safety and for ours. So we have some cones out there you guys can see when you drive up, and we can deliver your medications to your car if you're getting meds from us. So we'll be utilizing that as much as possible just to minimize risk to everybody. So just be ready for that.
Yes.
We might do blood draws from the car too if we can. So
that would be hard, really.
I did one this morning.
Very good.
Awesome.
Very good.
There's Heather.
Let's see. Questions about how long this will last. There's actually a couple of questions on that, and unfortunately, we don't know. This is too hard to say. I would anticipate a couple of months at the least. Once again, the projection on that is really too hard to say. I'd hope sooner. I wish sooner, but it might be a little bit longer than we would all like. Flying in an airplane, train, help him to wear a mask. Questions on that or answers? That's a good question.
I would if I had one. I don't want to create hysteria. I mean, I wouldn't be getting on a plane or a train unless it was
possibly be avoided.
Yeah, I mean, it would have to be really essential travel.
From what I've read in terms of the evidence about transmission on planes, it's still the same transmission according to the data. It's still the same for contact surfaces, meaning it's a cramped corridor and you've got a lot of things you got to touch. So, it's once again goes back to the hand hygiene, not touching your face. If the face mask helps you remind you not to touch your face, I think that's helpful. In terms of it being recirculated and it being transmitted through the vents, I don't believe there's enough evidence to suggest that. So therefore, the mask wouldn't be as effective from that perspective. But once again, I have a feeling travel is going to be quite limited for a while for obvious reasons.
The only reason to have a mask is if you're as close as James and I are now and you're talking, there's that spray that comes with talking. Yeah. But so if you're on the plane, and I saw someone put on there stagger the seats, and you can be, this far away from the person and you're not talking in each other's face and spitting on each other, which I know happens all the time. Then you're fine without a mask. But if you have one, then I would wear it. I mean, but they're saying there is that sort of if you touch it and all that. Right. I also heard, and I don't know how much truth there is to this, but if you turn on the vent and you put it kind of down to the floor in front of you on the plane, that it can kind of create this air shield. I heard this from a ID doctor. I don't know. That maybe it can kind of push particles away from you, create this vortex.
That sounds very theoretical to me, so I don't think I would hang my hat on that.
Airborne without them. Don't let someone sneeze.
If the droplets are coming at you and you have this vent pushing the air down, anyway. Yeah. Don't get on a plane if you don't have to.
Right. If you can minimize your exposure to planes, yes. Clearly, once again, a mask will not hurt you. Definitely, if you're sick, you shouldn't be traveling anyway. It's really been more recommended for people who are sick to wear a mask to prevent giving to others, but in terms of preventing you from getting sick from others. Once again, the evidence hasn't been that great, but once again, the risk-benefit ratio, if it helps you, I wouldn't say no.
Cool. Are we out of time? It's 1 o'clock.
We
Yeah,
are
it's
pretty
kinda
close
1
to our
o'clock.
time. Last final thing I just want to put out there, and again, some of the questions we might not have gotten to, we're going to continue submitting questions, and we're going to try to check in frequently like this, but I just want to have it be said to everyone to try to just go easy on yourselves right now. I know everybody's day-to-day life has been completely turned upside down, and I'm just hearing from my own friends and family and some of the patients that I've talked to. People are being really hard on themselves about, trying to work from home and also homeschool my kids and also just deal with this onslaught of information. And, it's going to feel awkward for a couple weeks, and we're settling into new routines here. So just go easy on yourselves. Don't expect yourselves to become epidemiology experts or school teachers homeschooling your kids overnight. We need to all just do the best we can, try to start settling into new routines. But know that that's going to take some time for things to feel normal. So deep breaths. Don't be too hard on yourself.
It's too
Maybe
fast.
I just need to hear that right now, being home with my 3 and 5-year-old and trying to figure out how to be a Montessori teacher, which I'm not.
I think she just talked to herself.
I
Like,
did. I just want you all to hear that. This is a
Yeah.
weird
Like
time.
SNL
and we're
skit
gonna
when
get
you're
through it
standing
together.
Shea was saying it to me this morning. I needed it.
We're all in this together.
yes. I gotta learn how to homeschool our kids.
Yeah, it's gonna be
Yeah,
interesting.
it's-
That's tough.
Well, thank you guys. We'll keep in touch. We'll do this again soon.
Yes.
Okay.
Bye.
Bye.